Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. I'm here with a special guest, Dr. Dana Gibbs. Dr. Gibbs is an allergist and allergy expert and board-certified otolaryngologist. She also directed allergy for a large ENT group for 18 years. And now through Allergy Access, her consulting company and online course, Dr. Gibbs helps private practice physicians to start and maintain evidence-based, safe and effective allergy programs. And today we're discussing 3 key things you should know about allergy testing and treatment. Welcome, Dr. Gibbs.
Hi, thank you very much for having me.
Yeah, glad to have you. So before we get into it, if you haven't already, please hit that subscribe button. You're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a board-certified family medicine doctor and a lifestyle medicine doctor as well, and owner of In Touch Primary Care in Sugar Land, Texas. And here we have a convenient and proactive approach to your healthcare. If you will like concierge-like approach to your healthcare, check us out at intouchprimarycare.com. So, Dr. Gibbs, let's get right into it. Can you tell us a little bit more about yourself and your background in allergy testing and treatment?
Sure. Okay. So allergy is supposed to be a core part of otolaryngology. It's something that we're supposed to get in residency, but a lot of us actually don't. But because ENT doctors see so much upper respiratory, sinus, and allergy goes right along with that. Allergy and asthma too goes right along with that. So it's kind of a natural follow-on to doing otolaryngology. And I didn't learn it in residency, but when I first started out into private practice, I would go and I would offer people surgery, and I would say, okay, we're gonna do this, and we get their CT scan back and there'd be nothing wrong. And I'd be like, oh, well, every other thing says you have sinusitis, except your CT scan is clear. So, and that would happen a while. Or the other scenario that would happen would be somebody would have horrible looking sinuses, and I would do their surgery, and they would come back and not feel any better. And it's just like, oh boy, what am I going to do with this person? They don't feel any better. And so I tried for a while, tried sending them out to the general allergist, and one of several things would happen. Either the allergist would do a test on them and say, oh, they're not very allergic, here, take this pill. Well, they already tried the pills. I already tried the pills. So that wasn't the goal I was working on. Or it would be too far to get there, or it'd be like, oh, it's a whole nother specialist copay, or, the shots are inconvenient because they're making me come 2 or 3 times a week. There were just a lot of things about it that weren't meeting my expectations. And so I said, you know what, I can learn to do this. And by this time I was actually starting to get really interested in it, because I was recognizing it more and more in lots of different scenarios. So I went back to the ENT Academy and took the classes and learned all the things and bought the books and made the consent forms and the questionnaires and all the stuff that you need to go ahead and get started in allergy. And I hired an allergen manufacturer, and they helped me figure out what I was going to test. And, I've just started. And it was funny because I was working for another doctor at the time, and he decided he didn't want to do it. And I'm like, look, I can't practice without this. And so I ended up going out and going solo. And it worked out. And I did that for about 4 years. And then a bigger group decided they wanted me in the bigger group because they wanted me to do it for the bigger group. And so I ended up in a 6-person ENT office directing the allergy clinic for that group. Of course, I still didn't do it all on my own. There was a smaller allergy society where I got lots of support, lots of mentorship, lots of here, I'll loan you my documents that you need. But that group went away. COVID paid to it. There were a lot older doctors nearing retirement, and most of them just said, we're done, we're retiring. And so that group ended up folding, and there isn't really anything like that anymore. And so my consulting business is kind of an attempt to recreate that collegial atmosphere, that here's a place where you can come in and ask questions and present case studies without bias, without manufacturers looking over your shoulder, telling you, oh, you ought to do it this way because it makes more money for us or whatever. And because I had been on the faculty, eventually, I was in the group long enough, I became part of their faculty. So I decided, hey, you know what? I can do this. And so here I am, trying to do my best to teach other docs how to do it.
Great. Yeah. No, that's awesome. And I've learned a lot from you too. So we have an allergy program, and a lot of the things that we do, I've learned a lot of things from you too. So you do a great job teaching other doctors.
Thank you. Thank you very much.
So let's get right into it. What are 3 key things that people should know about allergies that can truly make a difference for them?
Okay, sure. So the first thing that I'm thinking of is that allergies are an inflammation disorder in your body. And so anything that you do that promotes inflammation in your body also promotes allergy. And by that, I mean just silly stuff like eating a highly processed diet, for example. Drinking a lot of sugary drinks is another thing that I think of. Not getting enough sleep. Just really simple things that, if you think about it, it's like, oh, yeah, that's bad for my health. Why is it bad for my health? It's bad because it either suppresses your immune system or it promotes inflammation in some way. And so getting those things under control. I mean, I've had patients that came in, got allergy tested, and then said, no, I don't want to try allergy shots right now. I want to do this other thing. And have them go back and say, yeah, and come back to me and say, you know what, I'm all better. And I'm like, what did you do? I gave up caffeine. I gave up junk food, and everything went away. And I'm like, well, hallelujah, that's fantastic. So that's one thing, is that really allergy is inflammatory in nature, and it is wrapped up in your entire health of your human organism that you are. The next thing, let's see, another thing is that allergy is something that can wax and wane through your life, but the tendency is something you're born with, and it never completely goes away. People will say, oh, I was allergic when I was a little kid, or I was allergic to eggs when I was a little kid, and I'm not anymore. And I'm like, well, okay, but you're having a stomach ache every couple of days. Let's try not eating eggs for a few days and see what happens, because you can lose the tendency, but it never completely disappears. And so if you have a period of time in your life where you have excessive stress or something like that, then they can come back. And so that's another thing to think of, is that allergy is this seasonal, cyclic, waxes and wanes, never completely 100% goes away. So you can manage it, but it's not gonna just disappear. So that's one thing. And then another thing that I can think of to say is that, so let's talk about over-the-counter medicines just for a second. So there are lots and lots of different brands of over-the-counter medicine. There are different combinations of over-the-counter medicine, but there aren't that many actual ingredients in most over-the-counter allergy medicine. As a matter of fact, so there are two molecules, let's say, that are decongestants. One of them is pseudoephedrine, one of them is phenylephrine. There was a third one called phenylpropanolamine, got taken off the market because people were using it as diet pills, and it was just a bad thing. But there are two pill or liquid decongestants. And then there is another decongestant that you spray in your nose called oxymetazoline. Sorry. And when people look for allergy medicines, they're like, oh, I cough, I sneeze, I want this one, this combination. The problem with it is it's got the same ingredients as this other one over here, and this other one over here, and this other one over here. And you're much better off going for the ingredients. If you can figure out, okay, I need a decongestant because my nose is stopped up. I need an antihistamine because I'm itching. And antihistamines are things like diphenhydramine, which is the brand name Benadryl, chlorpheniramine, which is Chlortabs. And then there are some longer acting. So chlorpheniramine, diphenhydramine, and sorry, blanking on the third one, brompheniramine. Those are the three short-acting antihistamines. They are really going to make you sleepy. They're going to make you tired. They're going to impair your performance. They're going to dry your eyes out, dry your mouth out, dry your nose out. And so you have to keep in mind with those ingredients what's happening to your body. You can combine that with a decongestant, and the hype up from the decongestant may help you not be as sleepy, or may make you feel like you're less sleepy, but you're still getting impairment if you're using those short-acting antihistamines. Then the third ingredient would be a longer-acting antihistamine, such as your fexofenadine, cetirizine, loratadine. Those are Zyrtec, Claritin, and Allegra. Those last from 12 to 24 hours in your body, and they have much less likelihood of making you have a dry mouth, dry nose, dry eyes, sleepiness, but they still have some little bit of that tendency. So what I tell people is, and I'm kind of getting to the point now, is that you want to pick your over-the-counter ingredients separate. So don't go for multi-symptom cold medicine. Go for one pseudoephedrine plus one cetirizine, which is Zyrtec. If you still need something after that, and the symptom is stuffiness, sometimes what you actually need is a moisture spray for your nose, because if your nose is dry inside, it's going to feel stuffy. And people are like, yeah, my nose is stuffy, but not dripping. I'm like, then it might be dry. And there are lots and lots of things that you can do, including, for example, the nasal saline washes, which are gaining popularity. And I'm glad, because I think they're super, super helpful. And most people who have allergies, if they will plan a very careful over-the-counter allergy medicine plan, they can take care of that. Oh, I get bad allergies in the fall, I get them in the spring. How long? Oh, 1 or 2 weeks. That is a kind of person who does not need a steroid shot. They do not need to be on allergy drops or allergy shots. They really just need a better way to manage their over-the-counter medicine. So yeah, that's kind of where I'm going with that.
No, that was great. That's great, breaking it down like that, so that people are paying attention to the ingredients, so that they can be much more effective in actually treating the symptoms. I think that's awesome. So let's talk very briefly about allergy shots and allergy drops. Like, when should people start thinking about more than just over-the-counter medications?
Sure. Okay. So I start thinking about allergy shots and allergy drops if people are having, for example, sinus infections that are really drawn out, where you're like, okay, I took one antibiotic, I took two antibiotics, I took three antibiotics, I took a round of steroids and another round of steroids, and it didn't go away. And my doctor got my CT scan and it didn't show anything. So we know this is allergy, but it's lasting months instead of days. Or if it's associated with asthma, like I get congested and then my asthma flares up. Almost always in people who are having repeated bouts of asthma that seem like they are related to exposures, like it's in the spring and in the fall, or it's every time I spend time outside, or I'm a soccer player and I'm playing in grass, and every time I get out there, I have to use my inhaler. That to me is a good reason to do it, because asthma can actually be reversed by allergen immunotherapy. And by immunotherapy, I mean allergy shots or multi-ingredient allergy sublingual drops.
Great.
So those are the kind of people. And I would say I arbitrarily say 6 months a year is a cutoff, but there are other reasons why I would do it. So say somebody just cannot tolerate over-the-counter allergy medicine. The dry mouth is horrible, the sleepiness is horrible, the whatever. And they have more than occasional trivial symptoms. That's the kind of person I would really strongly say allergy drops or allergy shots is a good idea for you.
Yeah, great. Thank you for sharing that. So let's also talk a little bit more about the services you offer to, and I know this is for physicians mainly, but I think
sure, yeah.
People hear a little bit more about that, and then also where they can find you.
Okay, so I have a consulting business and an online course that is paired with that, where I help doctors either refine if they already have an allergy program but they're not happy with it, or start a whole new allergy program in their office. And I will work with any physician who wants to do that, be they a small office or a larger office. I prefer to work with doctors rather than mid-level providers, because doctors have had the medical school training, the immunology, and then they really understand these subtle interactions that I was talking about, where this is an inflammatory disorder, it's related to this other thing and that other thing, and everything balances itself out. So I prefer to work with doctors when I'm doing that. Preferably independent docs. I mean, I have worked with a few people who were in larger health systems, and that's okay, but there tends to be a lot of administrative hassle and headache in a larger health system, where they're saying, oh, well, you have to do it this way, you can't do it that way, you have to use this manufacturer over that one. And that makes it just a little harder. I mean, it's still doable, but it makes it a little bit harder. And one of the kind of docs that I like to help really a lot is people who, physicians who have already been working with an allergy services company and are finding that their patients either aren't getting well, or there's some other reason why things aren't just going as well as they were thinking it would do, or they're like, look, I know more now, I can do this on my own, I just need a little help setting everything up. Those are the kind of people I really like to work with, because they have already seen a little bit of the benefit, but I can just next level that for them.
Great. Thank you for sharing that. And how can people find you?
I am on the web at www.allergyaccessmd.com. I can also be found on Instagram, Facebook. I am Dana Gibbs MD on Instagram and Facebook, and I am also at Allergy Access MD on Instagram.
Awesome. So you heard it. Dr. Dana Gibbs, she's very, very, very knowledgeable about allergies. So if you're a physician and you want to either start an allergy program or continue your allergy program, this is an awesome person you want to connect with. And we're going to have all her information in the chat so that you can connect with her easily. So we've come to the end of today's segment. Thank you for listening. Remember to subscribe and share with someone that might need it. You never know, it could make a huge difference for them. And if you're in the Houston area and you have allergies, please call us 713-280-9985 to learn more about our allergy program and how we may be able to help you. All right. Thank you, Dr. Gibbs.
Thank you so much for having me, Dr. Ashaye. It was really fun.
Yes, it was a pleasure. Thank you for being here. All right, everybody, have a good rest of the day, and we'll see you next week.